Hello, my name is Mistry and I'm doing my final course presentation for my course of healthcare ethics, and I'll be going over the principles of autonomy and informed consent and how they are important in the industry of healthcare. One of the most important ethical issues in healthcare is liberty. The first slide talks about the ideas. It means you have the freedom to choose. As a part of freedom, informed consent says that patients should know about the medical matters and treatment before they agree to them. People should be able to choose their own healthcare, which is what autonomy means when it comes to morals. Giving a patient all knowledge they need before getting their permission is very important. This is what informed consent means. Both ideas protect patients' rights and encourage healthcare workers and patients to work together to make decisions. Autonomy means letting people choose their own medical path, taking their taste into account. There is a lot of information on this slide about how important freedom is in the healthcare and how everybody has the right to it. Liberty gives people the power to make their own decisions about their healthcare, which makes them feel like they are in charge of their health. Healthcare workers get patients more involved in the treatment, which is good for their health because they see patient as one who makes the most important choices. Patient has the right to liberty, which means they should be able to make their own medical choices. People feel more in charge of their health when they have a say in how they are treated. It improves their health. Focusing on liberty empowers patients to make decisions and become more active in their treatment. A big part of freedom is being able to trust the people who work in the healthcare. The reason for this is that it makes both sides more respectful. An important part of liberty is getting educated permission. This slide shows the steps that need to be taken to get the consent. First step is sharing information, which means that healthcare workers have to give full details about matters they think would be the best. People who are sick need to be able to understand what is being said so that they can make good choices. It is clear that people need to be able to choose without being pushed to be a certain way. This gives their freedom to choose from themselves. Since giving information is the first step, patients who work in the healthcare must give all the information they have. Making sure other person can understand what is being said is what it means to be patient. A lot of people stress how important it is for them to be able to choose without being pushed or swayed away too much. Competence of patients means how will someone can understand the things and make choices. This slide talks about the many problems and things to think about when it comes to liberty and the educated consent. Cultural difference makes more complicated because different values can affect how people understand and accept medical knowledge. Evaluating someone's ability to make decisions is complicated and needs to be done carefully to make sure that the person can make smart decisions about their healthcare. Getting educated permission the normal way is harder to do in emergency because there are limited time available. This case study shows how liberty and informed permission can be used in real emergency situation. Patients' mixed cultural background shows how hard it can be to accept liberty from different cultural point of view. And because healthcare workers knew how important it was to be culturally competent, they changed how they talk to patients to fit their cultural value. This made it easier for patients to fully understand the medical knowledge. It can be hard to accept someone's right when their cultural values are different, and as shown by the case of the patient from diverse background. As stated by Moorhead, Swanson, and Johnson, cultural knowledge is very important to healthcare workers. They make sure that the information they give the patient fits with their culture and the patients fully understand it. It was tested how well the patient could make tough decision with the possibility that living in a different place might make it harder for them to do so. The people who work in the healthcare in this case show that they would be open to process of getting informed consent. There are numerous strategies to improve informed consent and liberty. Teach healthcare professionals. Cultural skills matters in diverse ethnic situations. Second, gain informed consent from very varied learners and languages via appealing video platform. There are numerous strategies to improve informed consent and liberty. Teach healthcare professionals. Cultural skills matter in the diverse ethics situation. Second, gain informed consent from varied learners and languages via appealing video platforms. Make sure that the healthcare workers keep learning about cultural literacy and have the rights to use tech-based method to make the process of getting informed agreement better. Encourage people from different fields to work together to solve different decision-making problems and keep up with the changing moral and legal standards and make sure that changes are reflected in healthcare policies. With this, I'm completing my final project for my case, healthcare ethics. Thank you and have a good day. Bye bye.